Hey everyone, this video is about ankylosing spondylitis, or what happens when your ligaments start to harden and fuse. This is information about the causes and symptoms. Check it out. Hello everyone, Dr. Jason Wes in the Wes Clinic, coming at you with 102 years of clinical healing. We're going to talk about a type of arthritis called ankylosing spondylitis. Now what that means, it's a big mouthful, but basically means the ligaments in your body start to harden and fuse. And primarily it likes to take place in the spine, but other joints are involved as well, particularly the sacroiliac joint, which is, there's one on the right and one on the left, just barely underneath your belt line. And what happens over time, inflammation in these ligaments can lead to moderate to significant to severe pain. And the severity of the ankylosing spondylitis varies from person to person, but it is a chronic, lifelong disease that can be managed. There's hope. Remember, you are not your diagnosis. And if we treat the person and the causes, we can usually get really good outcomes with ankylosing spondylitis. Now, the way we test for this is to measure a marker in the blood called HLA-B127. And individuals that have this marker seem to have a lot higher incidence of ankylosing spondylitis than those that don't. Now, this is almost always in a certain population, Caucasian population. I think it's 97% of the people that have AS have this marker, but it's not an end-all be-all diagnostic test. And there are other genes that expert believes may contribute to ankylosing spondylitis. And also there's an environmental factor. There can be bacterial infections that may be present that can really cause these ligaments to be injured. And what happens is when they get injured, then they get scar tissue, and then the scar tissue hardens. And when you do an x-ray, they call it a bamboo spine. It looks like it's just a big stalk of bamboo where the spine is. But it can affect many different joints, and it's all related to the ligaments. Now, some arthritis comes on in older individuals, but ankylosing spondylitis is unique in that typically it presents in ages of about 17 to 45. Now, not every individual with ankylosing spondylitis will experience the same intensity of symptoms. There can be mild cases that may only experience occasional back pain, but some people can have severe cases and may experience, again, a fusion of the spine and have severe complications. And in extreme cases, ankylosing spondylitis can be disabling. Now, there are various problems that ankylosing spondylitis can lead to, but some of them are common than others. For instance, it's not uncommon for individuals to develop an irritation in the eye. It's also not uncommon to have what they call enthesitis, which is an inflammation where the ligaments attach to the bone, or even a fusion of the vertebrae to the ligaments. And it can lead to an incidence of kyphosis, which means you have an exaggerated hump in your back. It can be a contributing factor to inflammation in the jaw, which may lead to difficulty in eating. It can inflame the eye or the iritis or uveitis, and it can inflame the cartilage connection from the rib cage to the sternum called costochondritis. Now, it also can lead to a decreased chest expansion, and it can lead to fatigue, either due to lack of sleep from the pain or discomfort from the body, which is in a constant state of inflammation. It can affect the hip and the shoulder, but again, the classic cases are in the spine and in the sacroiliac joint. This is Dr. Jason Wes talking about ankylosing spondylitis. There's a blood marker, there's a genetic component. In the next video, we're going to talk about nutrition, we're going to talk about treatments, we're going to talk about what you can do to prevent and minimize the symptoms of ankylosing spondylitis. This is Dr. Jason West, and we'll see you on the next video.